So tell us a little bit about essential oils.
So essential oils. Wow. Well, essential oils can be used for so many things. They could be used to help relieve stress. They could be used to help facilitate sleep. They can be used to alleviate pain. They could be used to help with gut issues. There are so many oils, and they're literally such powerful substances that a little small amount goes a very long way. You could use it topically. If you are going to use it topically, you have to be careful with what oils you're using because they should be diluted. And you can take some of them internally as a supplement, so you can get a more systemic effect. And then you could also use them aromatically in a diffuser, or simply taking a couple of drops and applying it to your hands and breathing them in. And that activates our olfactory system, which has so many properties and helps trigger so many things. It can help with your emotional health, your physical health, and your mental health, which are the three things that kind of keep us balanced.
Right. So give us an example of a essential oil that has an aromatic effect that stimulates our olfactory senses. Give us an example of the most popular oil that does that.
The most popular one would probably be
Sure.
lavender.
I was thinking of that. I was glad you answered that. So do you have any examples of how patients have reacted to lavender essential oil?
I mean, usually lavender essential oil is something that I usually recommend to help for relaxation, to help sleep. So one way that I personally recommend using it is in a roller ball, because it makes it a lot easier to apply, and it's usually pre-diluted. You could apply it under your feet, especially to your toes, the big ones. That will help activate your relaxation system. You could apply it to your temples, back of your neck, on your wrists. You could diffuse it in a diffuser to help make your sleeping environment more relaxing. And I mean, if you really want to take it to the next level, you can, put a drop under your tongue, or pour a drop in a 4-ounce glass of water and ingest that too, because you can actually ingest lavender.
So I have a story about lavender.
Mm-hmm.
So we were driving somewhere one time, and there was a toll booth where we were driving through to pay a toll for a road.
Okay.
And this toll booth was surrounded by lavender bushes. And we drove up to the toll booth, and the lady is like nodding off,
Oh my God.
sleeping. And we're like, "Are you just?" She's like, "Yeah, are you just tired, or what's the deal? Did you not get any sleep?" She's like, "Oh, ever since I took this job, I just get really tired when I'm working in this booth." And she was surrounded by lavender bushes. So does it makes a lot of sense. And
Yep.
when you think about things that have stood the test of time, we've known for years that a relaxing lavender bath
Right.
helps us sleep. So, for those that think that essential oils are not medicine and really are not a good treatment for certain symptoms, I mean, we just have to think if something's been around that long, there's probably some validity to it. Do you have any comments on that?
I mean, they put lavender fragrance in bubble baths, so that when you give your baby a bath at night, they get sleepier. So if they're using it as a fragrance, quote unquote, not to call it that, that they scent things with lavender to help promote sleep, there has to be some science behind it. Otherwise, why would they pick that particular scent?
Well, and how long have we been doing that? We've been doing that with
For
lavender for
ages.
hundreds or
Yeah.
thousands of years.
Thousands, thousands. The
Yeah.
history of essential oils goes back to like the Egyptians, the Romans,
Right.
a whole bunch of different cultures. So, I mean, it's kind of proven just by default that it works.
Right. Because it's been around so long.